Softball, we're certainly, unfortunately, seeing a rise in the number of softball injuries also. I'm very fortunate to be the head orthopedic surgeon for the University of South Carolina softball team. And again, unfortunately, what we're seeing is a significant increase in the number of injuries that we've seen in our college softball players. But by no means is that just a phenomenon that's happening here at the University of South Carolina. That is something that is increasing, the number of injuries are increasing nationwide. And so we're trying to figure out exactly why that is. And what we theorize, which is very similar to what's happened in youth baseball, is that softball is becoming more specialized. And in the past, when a very good younger athlete, female athlete, used to play volleyball and basketball and softball, now it's becoming more specialized and more year-round and more sport-specific, and so our young ladies are playing softball year-round. And again, which is very similar to baseball, we know that playing one particular sport year-round can certainly increase the number of injuries that can be seen. More specifically, obviously, is the question of windmill softball pitchers. There has been, I believe, a misconception that the windmill technique with regards to fast-pitch softball doesn't produce injuries, and we certainly don't agree with that. There are injuries that can occur with the windmill technique. Unfortunately, our science has lagged behind what we've known for a long time now. There have been many scientific studies that have been done on baseball players over the last several decades. We're just now starting to see the results of research with regards to softball pitchers. There have been several studies done looking at the stresses on various muscles and tissues and ligaments about the shoulder and elbow in a windmill softball pitcher. And we know that in certain phases of the throw, that those forces are just as much in the female softball pitcher as they are in the baseball pitcher. And again, what we're seeing is a significant increase in number of injuries, and so we certainly can surmise fairly honestly that these injuries are a result of overuse that are occurring and due to the stresses that are placed on the shoulder and the elbow and other tissues in our softball players. We're doing a study here in South Carolina trying to look at the number of injuries that are occurring in our high school athletes. We've just now started a study where we're tracking pitchers and we're tracking pitch counts and how many leagues they're playing in and how many days a week they're playing softball. And we're going to try to evaluate those numbers with the injuries that we see to see if we can get some more information with regards to injuries in our youth softball players and specifically our pitchers. Our goal again is to try to prevent injuries. Oftentimes we're in the back end trying to take care of injuries as they occur, but hopefully we can get to a point where we can prevent these injuries. And most likely that's going to come from simply having more knowledge of the game, more knowledge of the various forces placed on the body with pitching, and being able to adjust the number of games played, pitch counts, techniques, rehabilitation after your pitching, the amount of rest required to allow our pitchers to recover from their injuries so they can have a long, healthy career in softball.